I worked on a healthcare software startup for some time in a financial chief role, so I had a little bit of insight, but
Hmm.
not in-depth knowledge. But doesn't a lot of this stem from the adversarial relationship between payers and providers? That like you have medical providers, rendering the service, but they would charge much higher prices with the expectation that the ultimate payer, the insurance company or whoever it may be, is going to get some negotiated rate, 50, 80% discount.
Yeah.
And so it's just like a fight before it even begins. And it's the one experience I've had that was really silly. I can't even recall what it was. Some silly, like getting a piece of skin removed, something like that. Not a big procedure. On an insurance plan I was on, this is probably 5 or 6 years ago, they couldn't tell me how much it was going to cost before the
Hmm.
procedure. They can't tell you. You're like, well, how much is it if I just pay cash? They're like, we can't tell you.
Right.
I'm like, well, how much is it if my insurance pays it? Like, we can't tell you. I'm like, when can you tell me after you do it? I'm like, what are you talking about? Like, I'm signing a blank check and you just send me a
Tell
bill?
me another industry in this country where that happens. Like you have to pay for something before you actually know how much it costs. I mean, it's absurd. But
Taxation's the only one I would say that's close.
there again, exactly. And that's why the screwed up monetary system and the screwed up healthcare system are so interrelated and
Yeah.
so somewhat analogous to each other. Yeah, I mean, I think that people ask like why are healthcare costs so high, right? And I said, the way that I explain it is if you have the buyer of healthcare, which is generally health plans, and the seller of healthcare, which is typically hospital systems,
Mhm.
both wanting the price to go up, it doesn't take an economics PhD to know the price is going up, right? And so you might be like, okay, well, what do you mean the health plan wants the price to go up? Well, some brilliant legislator back when Obamacare was done told the health plans they could only make 20% profit of your premiums in any 1 month, right? So if I have $1,000 premium, the health plans can only make $200. So how does the health plan make $250? They have to increase your premium, right? And so they're actually incentivized for your premiums to go up.
Wow.
So this is the organization that's supposed to be on your side, negotiating for you, actually wanting your prices to go up as opposed to wanting your prices to go down.
Wow.
And so that's ultimately what is screwing up. And then add to that, 70% of doctors are owned by health plans or health plan related entities, right? So the people you're supposed to be negotiating with, you actually own. And so there's serious, conflicts of interest there. And so, all these things are really kind of keeping, health care prices going up as opposed to go down. There's no market forces here whatsoever.
Right. Oh, okay. So that's the right way to look at it then, is we've removed the market element. And so you sort of have this, I guess, form of collusion between payers and providers in a way.
It is ultimately a form of similar to collusion, and you will see in the news where I think United Healthcare and Wake Forest are butting heads right now. I think one of them got a little too crazy with their pricing, and that happens, but ultimately there is collusion in some cases. In other cases, United Healthcare comes to Austin, Texas, where I live, and there's two hospital systems. And so United is negotiating against a duopoly ultimately. And you can't lose one of those health systems in Austin because none of the employers in Austin will then want to sign up with your plan because your network is not, you have to have both hospital systems in your network. And so even if United Healthcare, which is the 7th largest company on the planet on revenue, wanted to negotiate with a hospital system in Austin, Texas, they can't because there's a duopoly there, right? And so that's also the challenge.
So when you say duopoly there, sorry to interrupt, but you mean legally mandated duopoly, something like that?
I mean, it's not legally mandated, but it's these hospital systems are buying up all of the doctor's office and the orthopedic, specialist office. And so ultimately what has happened is you've just got two big hospital systems in Austin. And, you know, the employer, if you're an employer in Austin, you want your employees to have access to both health systems. And so if United came in and tried to reduce the rates on one of the hospital systems, that, you know, they have no power to do that. They have no negotiating power to do that, because the hospital systems are like, fine, if you want to lose me, then you're screwed in Austin, right? And so
Wow.
so United and the systems are kind of like, okay, just raise the prices a little bit, but not too much. There's no downward pressure on pricing.
Wow.
You know, what I tell people is, I, as an individual, have significantly more negotiating power against the hospital than United does, interestingly, right? So let's just say I go and have a NICU baby, right? They're in the hospital for 90 days. It's $1 million bill. You know, the local hospital can come to me and say, I need $1 million for you. But what happens, right? I go bankrupt and the hospital gets nothing, right? So the hospital has to negotiate with me to get to a price that I can actually pay, right?
Wow.
So the market forces are taking over again and saying, okay, we're going to reduce prices because you can only charge as much as someone can pay. And that's, you know, we'll get into crowd health in a little bit, but that's ultimately what we're doing, is allowing the individual to negotiate those prices, as opposed to these big corporations who have no incentive to negotiate prices on our behalf.